you all ready? Because I'm ready. Let's welcome Dr. Donald Lloyd-Jones, incoming president of the AHA.
Can you lobby to be an AHA president? You can't. You volunteer for this extraordinary organization, you put your head down and you do your work, and you're committed to the mission because it's easy to be committed to that mission.
Don has been an avid American Heart Association volunteer for over 2 decades, known for his work in prevention, public health, epidemiology, and his critical role in shaping the association's strategic goals, as well as our work in communities throughout this country.
We've never been more relevant as an association. The pandemic showed us that what made us vulnerable as a population to this virus was the fact that we were not as healthy as we need to be. Well, here we are in the summer of 2021, and still within the last month, 1 in 5 Americans are reporting delaying a healthcare visit, a visit with their doctor.
We're moving forward with all these research platforms in equity, just recently funding a $20 million health equity research network to focus on preventing hypertension in the African American community in this country. If we could achieve the goal of even 50% of adults having high CVH, we'd avoid nearly 1 million cardiovascular events each year. So this is where it happens. This is where the conversations start the next wave of science and help us understand what we need to be doing to further the whole field of cardiovascular medicine.
This new law that goes into effect on January 1st, called the No Surprises Act, is meant to protect patients from these potentially devastating situations.
I'd like to encourage all of us, particularly in these challenging times, to get involved in the AHA as much as possible, and maybe in ways that don't seem as comfortable as usual. Women are really the gatekeepers to health for the whole family and really our whole society. And so it's so important for women to prioritize their health first. Jerry is a humble man, and it would take a long time to list all of the things that will mark the legacy that he has created in science.
A scientist who selects his own greatest contribution is a foolish person. I leave it to history.
What's the first thing you remember when you woke up?
I think the first thing I remember was having a conversation with the CCU attending Dr. David Harris, where he said, you must have received very high quality CPR in the field. I said, how do you know it was high quality? He said, because I'm sitting here talking to you and having this conversation 24 hours after your cardiac arrest.
Making sure we are champions for health equity. I think that's going to be the clarion call for our second century.
Final thought, he's a great guy.